Dear Chairman Wyden and Ranking Member Carpo, my name is Ashley Balunta and I am a BSW social work student at the University of South Florida. I am present to express my support for passage S3430, the short title Better Mental Health Care, Lower Cost Drugs, and Extenders Act of 2023. The social issue of an effective and affordable healthcare system was addressed by Titles 17 and 19 of the Social Security Act. However, while those two titles have improved comprehensive coverage and financial assistance, they falter on the topics of mental health and medication affordability. The aim of S3430 is to amend Titles 17 and 19 of the Social Security Act to expand the mental health care workforce and services, reduce prescription drug costs, and extend certain provisions under Medicare and Medicaid. Many of the people in my life have been affected by mental illness, and the issue has only been made more prevalent by the pandemic. The ongoing mental health crisis in the country cannot be understated. Title 1 of S3430 would work on expanding the mental health care workforce and services under Medicare and Medicaid. It addresses a motion to increase eligibility for incentives in the Medicare Health Professional Shortage Area Bonus Program, changing eligibility to include non-physician healthcare professionals such as physician assistants, nurse practitioners, clinical social workers, and more. Other provisions address access to the mental health services under the Medicare program. Medicare provides coverage for specific behavioral health services administered by CSWs for diagnosing and treating mental health conditions. Yet Medicare does not include coverage for health behavior assessment and intervention services offered by CSWs. S3430 proposes that CSW services covered under Medicare Part B to be changed to include health behavior assessment and intervention services. Additionally, Title II is directed at reducing prescription drug costs under Medicare and Medicaid by securing pharmacy access and choice for Medicare beneficiaries, as well as defending seniors from excessive cost sharing. The American Hospital Association, AHH, has stated that integration of behavioral health services into team-based care models improves patient outcomes. Section 101 of Title I would increase the payment under Medicare physician fee schedules for certain behavioral health integration services. As such, not only would this benefit patient outcomes, but it would also spread integration by clarifying the application of team-based care models. Within the United States, it is quite common for people in need of mental health services to experience limited access to care due to provider shortages. HPSAs identify areas experiencing health professional shortages. The number of practitioners needed to remove HPSAs designations in the U.S. is 7,871. With S3430, the number of eligible providers is increased by including those non-physician healthcare professionals. Moreover, the bonus payment increases from 10% to 15%, which is likely to alleviate the issue of provider shortages. Additionally, unaddressed mental health issues tend to negatively affect issues such as homelessness and poverty. Should this policy improve overall mental health with those with Medicare and Medicaid, it would mitigate the consequences of unaddressed mental health issues. S3430 is well thought out and addresses multiple gaps in Titles 17 and 19 of the Social Security Act. This policy would touch the lives of 18.8% of the population that is being covered by Medicaid and Medicare. That is roughly 60.5 million people being affected for the better. These amendments to Titles 17 and 19 of the Social Security Act are a step towards more comprehensive health care. Thank you for listening to my testimony, and your focus on these issues and consideration for the offered solutions is highly appreciated.